All right. Well, thank you to all the previous presenters and the organizers and to all of you who are here tonight. It is an extreme honor to be here. Yes, there we go. So at 9 years old, I became the unexpected anchor in our fractured home. After my parents divorced, our lives split into two. 1 week at my dad's house near my friends and school, the next at my mom's apartment miles away. As the oldest of three, I watched over my 5-year-old twin siblings while my mom worked 3 jobs in order to make ends meet, sometimes gone from 5 o'clock in the morning until 11 o'clock at night. I became the family caretaker. One life-changing bright spot was when my Nana and Papa bought me a pink and white checkered Schwinn bike with a white basket adorned with colorful plastic flowers. I filled that basket with Band-Aids, cotton balls, and Ace wraps from our bathroom cabinet. I had a mission to find people in my neighborhood who were hurt and needed help. I pedaled up and down the blocks with fierce determination, eyes scanning for anybody who might need my care. Well, guess what? Turns out it's really hard to find injured people just lounging around, waiting for a 9-year-old. But even with 0 patients on my roster that day, something was healing in me. The simple act of searching for others' pain to soothe was soothing my own. It was my first calling to a lifetime of seeking to bring order to suffering. Years later, during my first master's degree in public health, I was in a women's health class that required us to read a book about psychoneuroimmunology, the scientific study of how the mind and body connect. Reading about the innate connection between our thoughts, our emotions, and physical health, I felt something in me that I had never experienced before, a knowing that resonated with my entire being. This wasn't just an interesting concept. This was my mission. It was as if all of those childhood days of pedaling with bandages had been preparing me for this revelation. I then pursued my master's and doctorate in Chinese medicine, and for the past 22 years here at Rush University Medical Center, with 18 years dedicated to integrative oncology, I've carried that same lifelong determination to help people heal, now transformed into using evidence-based practices that bridge ancient wisdom with modern medicine. In these 18 years, I've had the extreme privilege and honor of providing acupuncture to thousands of cancer patients. Thousands, most seeking help for pain. But in my conversations with them, one heartbreaking theme has emerged again and again. Patients come to me frustrated and sometimes even angry, not at their providers, but at a system that has left them suffering for months and sometimes even years. One woman recently asked, "Why wasn't I told about this sooner?" I've heard that same question asked hundreds of times from patients of all ages and backgrounds. This country has a cancer care crisis, a crisis of communication that is causing needless suffering. When patients with advanced cancer are asked, "What matters most to you?" their answers include avoiding pain and suffering, having physical independence, and living as long as possible. Yet, the reality is stark. Pain occurs in up to 50% of cancer patients. 80% of patients with advanced stage cancer experience pain that is moderate to severe. And even more concerning, nearly 1 in 2 cancer survivors who experience pain report that it is inadequately controlled. It manifests in devastating ways. Peripheral neuropathy can send burning electrical jolts into the limbs, making walking treacherous and falls common. Radiation can leave the skin scorched and raw. Chemotherapy can create mouth sores that transform the simple act of sipping water into torture. Imagine your entire mouth feeling like the worst sunburn of your life. Raw tissue covered with weeping ulcers. Every swallow triggering searing pain. Making even speaking a deliberate choice between communication and suffering. And then there's the joint pain from aromatase inhibitors, a treatment that forces my young breast cancer survivors in their late 20s and early 30s to wake up in bodies that feel 80 years old, fingers too stiff to type, knees that scream with each step, hips that lock up without warning. You know, cancer doesn't just threaten lives, it transforms what it means to live. And the failure to communicate about integrative approaches is truly devastating. Poorly controlled pain can lead to depression, decreased quality of life, hospitalizations, and even early discontinuation of treatment. This communication breakdown between patients and clinicians breeds dissatisfaction, mistrust, and hopelessness. Simply put, it jeopardizes survival. That is because crucial conversations about integrative approaches simply aren't happening. Up to 70% of cancer patients aren't disclosing their use of integrative therapies to their healthcare providers due to fear of disapproval or judgment. Meanwhile, even though up to 66% of oncologists truly believe that integrative approaches are beneficial, many hesitate to bring these options up due to time constraints, limited training, uncertainty about the evidence. Discussions about managing side effects get crowded out due to treatment options and clinical outcomes. You know, this is not at all about blame. Not at all. But it is about recognizing a communication gap that is causing unnecessary suffering. Yet these conversations are worth having precisely because the therapies that they would introduce can transform patients' lives. When I speak about integrative approaches, I'm really referring in this context to integrative oncology. I mean, and these are evidence-based practices that are used in conjunction with conventional cancer treatments, acupuncture, massage, meditation, yoga. These aren't fringe therapies. These are science-backed practices that help empower patients to become active participants in their care. Take Dora, one of my patients, a 65-year-old retired principal, diagnosed with pancreatic cancer, came to the center because she was dealing with horrific peripheral neuropathy. It was so bad that she had lost strength in her hands and was experiencing debilitating stabbing pins and needles in her feet. After the first acupuncture treatment, she came back and said that the pain had reduced by 20%. After the fourth, it reduced by half, and she was sleeping through the night for the first time in months. A simple referral could have spared her months of suffering, months. And then Lynn, a 41-year-old social worker with Hodgkin's lymphoma, came to be seen by my acupuncture intern team. She came to us because she was experiencing pain in her toes, contractions that were a 10 out of 10 on a pain scale, truly, truly debilitating. After the first acupuncture treatment, I kid you not, her pain reduced by 95%. I can feel things again, she said. You know, these healings aren't the result of acupuncture alone. At Rush, right here, our supportive oncology team consists of an entire collaborative interdisciplinary team of dedicated professionals, psychologists, psychiatrists, chaplains, dietitians, patient navigators, acupuncturists, massage therapists, physical medicine and rehab, and many more, all addressing the whole person, not just the disease. And the data confirm what we see clinically. Up to 65% of patients really agree that integrative oncology improves well-being and quality of life. And research shows that hospitals with even a moderate amount of integrative oncology involvement have 5-year overall survival odds. So this is my call to action. Imagine if every cancer center implemented structured conversations about integrative oncology at the point of diagnosis. Imagine if every oncologist was trained to discuss not just survival, but pain management, emotional well-being, and whole person care. Imagine if every single patient felt empowered to discuss their needs, knowing that their healthcare team was listening. The result would be less pain, less suffering, better adherence, and longer lives. This is not just an opportunity. This is an obligation. And guess what? The solution is within reach. Healthcare providers don't need to reinvent the wheel. ASCO and the Society of Integrative Oncology have already developed comprehensive evidence-based clinical guidelines to help clinicians manage the side effects of cancer treatments, pain, fatigue, anxiety, depression. A simple question in clinical encounters to a patient such as, how is pain and fatigue affecting your quality of life? Can lead to solutions. The medical team can connect patients with supportive oncology, integrative oncology from day one. A simple referral at diagnosis, not as a last resort, can transform their entire cancer journey. Patients also need to know that their voice matters too. If they're experiencing pain or suffering, please, they need to know to please speak up. There are safe and effective practices that can be of great help. They deserve to know all of their options from day one. You know, cancer steals so much, but unnecessary suffering shouldn't be part of the fight. When pain is relieved, something extraordinary happens. Hope returns. And patients regain control over their lives. And the impact extends far beyond the treatment room, improving relationships, careers, and the ability to engage in community once again. The little girl I once was, pedaling with bandages in her basket, searching for someone to help, has found her way to this moment. To this calling, it truly is my life's calling. And my journey has taught me that the impulse to heal, to bring order to chaos, to ease suffering, isn't just childhood idealism. It is the foundation for transformative medicine. When we break the silence about cancer, pain, and suffering, we don't just improve medicine. We restore humanity to healing. Because in the end, what matters most is not just adding years to life, but adding life to years. And this is how we end the cancer care crisis. Not someday, not eventually, today, right here, with us all breaking the silence together. Thank you.